Good afternoon, ladies and gentlemen, and welcome once again to the Royal Society of Medicine's COVID webinar series. This is in fact the 17th we've been having. I think we should find something special to do for our 19th when that comes up next week. So, guest today is Gus O'Donnell, Lord O'Donnell, who will be well known to many of you as the most eye-wateringly impressive CV I've ever seen. After starting off his life as a junior economist and academic, he joined the civil service as the treasurer in 1979, and we'll pick up that, I'm sure, later, but ended up in 2005 right at the top, cabinet secretary and head of the civil service, a post he held until he retired in 2012. So Gus, welcome to the show. Oh, what a shame we can't see your library. I do love looking at people's books at this moment in time when we first see where you are, but it looks very tasteful, very pleasant. So let's start a little bit with your time when you were at the top. No stranger to crises. In fact, you handled probably one of the biggest crises that we've had until the present, namely the economic meltdown of 2008. So talk us a little bit through that and how that compares to the present.
Well, it was a very different kind of crisis, as you rightly say. It was an economic crisis, which meant that most of the expertise we needed was in-house. But in addition, we did bring in the best economists in the world to tell us. We brought them to London. The big contrast, I'd say, is it was a time when global economic cooperation worked rather better. If you look at the Excel Centre in London, the Nightingale Hospital, it's a kind of symbol to me. That's a hospital which hasn't been used much. It was the site of the G20 summit for the global financial crisis. Everybody came together. We had President Obama from the US. We got everybody to agree that we would learn the lesson of the previous big depression, namely do not go into protectionism. And by and large, that held true. And the British Prime Minister Gordon Brown was able to leverage the whole of the EU to get the message on side to make the G20 work and bring about global cooperation. This time around, cooperation's been, to be perfectly honest, abysmal mostly. You've seen protectionism in terms of PPE. We might see more protectionism in terms of distribution of a vaccine if we get one. So it's been hard. I'm sure the scientists have been trying to cooperate as best they can, but it is a very different kind of crisis, and the lessons don't translate across as much. I think we felt that we had a lot more control, and we felt that we knew some of the things that had gone wrong, like not appropriate regulation of banks, and we knew that we needed to save the banking sector, to save the economies and get them back on working, and that we had the tools to do that.
But you did face a really acute crisis. I mean, I've had stories of, the weekends without sleep, the fear that the cash points wouldn't actually work on Monday morning when we all got up, and what kind of a panic that would produce. I mean, it wasn't, you make it sound rational and calm and step by step, but there must have been moments when it was anything but.
No, the weekend before was pretty horrific, because we got the chair of the main banks in and said, what's going to happen on Monday? And the rather surprising answer we got, first of all, was we're not sure, which was deeply worrying. So we sent them away and told them to come back and tell us. And it was quite apparent then that a large number of them would fold, and we would have a run on the banking system. But that's something we knew quite a bit about. So that meant that we had to take big stakes in banks. We had to directly intervene. We had to do some radical things. But they were, I think, within the scope of what economists had known about. Runs on banks, we know a bit about that. We know about liquidity crises. And so most of the things that you knew you'd have to do, you could do. You also worried there would be long-term consequences. The banking system would take a long time to recover. That would mean that business would take a long time to recover. But it wasn't the issue of a very visible, immediate people dying. That wasn't, it was an economic crisis, not a health crisis. The problem we've got now, of course, is we've got the combination.
We do indeed. But also, in terms of, as being leader of the civil service, how do you think the civil service are coping at the moment? We've had to deal with one long-ending, demoralizing crisis over Brexit, and now we're straight into another pretty shattering, again, major crisis, maybe worse, over the virus. I mean, how much can a system take? How much can the people who would have worked for you, how much can they take?
Well, to be honest, if you're in the civil service, let's be honest, crisis-focused minds. We did things during the global financial crisis, like take big equity stakes in banks that, you would have thought, God, nationalising banks, my goodness. So it's when you realise that your job really matters, that you can make big decisions. You can turn the country around by a massive lockdown. So in that sense, it's very rewarding in that there's a big problem and you can do something about it. So I think it's wrong to think that civil servants are not in some ways energized by this. They know there's this massive global problem and they know that they can do something about it. So in that sense, it's energizing. So people will work very hard. The problem, of course, with this crisis is normally, you'd be having people together, you'd be meeting, there'd be lots of personal interaction. Trying to do this at the same time as you're learning all about doing it all by Microsoft Teams or Zoom or whatever, that's much more complicated. And it's a more complicated crisis because, to be honest, God bless all of you medical people, but trying to manage that relationship between scientists and the civil service and government is quite complicated.
Do you think that they're managing it well at the moment? Or that was not meant to be a leading question, actually.
Well, I think there is a problem that, as you can imagine, politicians think of this first and foremost as a political crisis. The government's going to be blamed for all of this. The government needs to handle this well. The country needs to come out of it well. What's going to be the biggest problem for us as politicians? Well, the answer is the visible and the immediate. What's visible and immediate? That's people dying of COVID, the hospitals being overrun, no room in the units. So that's where you said put all the attention. And you need to do some dramatic things to slow it down. The scientists are telling you lockdown is needed. This is a dramatic behavioral change. So you need to get across to people that you're trusted. Now, we know that trust in politics, the gap between trust in politicians and trust in civil servants has never been as large, right? That was true at the end of last year as well. So you try and get trust, and the way you do that is by having people who are credible and trusted around you, which are the scientists. Everyone loves them, The only other better people would be people in uniforms, so maybe you should have had a few more white coats.
We gave that up for infection.
You need to get that trust. Sorry?
We gave up the white coats because of the infection risk.
Indeed.
Yeah.
But you need to get the message across. And so what they've concentrated on doing is getting that health message across. And they've done it in a very relatively simplistic way so that people understand it. And of course, the problem with the solution, which was lockdown, is that it creates an economic crisis. And what you've got then is a group like SAGE, which has a lot of medical experts and scientific experts and some behavioral people, not enough in my view, but no economists. And you're creating an economic crisis as well. And you're creating all sorts of social issues. So to my mind, what's been left out of the government response has been the word social. Lots of scientists, but no social scientists. If you look at the messaging, social distancing, oh my God, what a stupid message. We want physical distancing and we want social togetherness, right? We've got that wrong. And therefore that has consequences, and that has consequences as you move through the stages out of this crisis as to how effective your messaging is going to be.
Well, may I remind you, you were press secretary to a former prime minister for, I think, 4 years, and So I think it is reasonable to ask you to elaborate a little bit about, well, you've again hinted, but expand a little bit more on, I mean, the messaging started out well, didn't it, Gus? You would agree? They did get, it has to be simple. It has to tell you what to do. You need to know what to do, why and when. And I think that was pretty good.
So if you observe people's reaction to the government, first of all, the whole lockdown thing massively reduced people's well-being quite dramatically. And fortunately, we can measure that. And so we know that quite clearly. But as you're absolutely right, the certainty of lockdown helped people and it started to come back up. That's since fallen away quite dramatically as well. So yes, it was simple messaging, but simple messaging based on, I would say, fear, right? The most important aspect of this messaging, the thing that probably got through to people most, was the fact that the Prime Minister ended up in intensive care for a few days. That really brought it home. And if you look at the media coverage, even last night on BBC News, massively about what's happening in all of these units, intensive care units around the place. So it's very, very scary. So individuals, very scared, stay at home. Yeah, absolutely. Okay, we worry about this. It's very scary. As you go through a period where if the lockdown works and you're on plan, the degree of fear will come down, the number of cases come down, and you're emphasizing all the time in your press conferences, number of cases, number of deaths, the visible bit. No one's talking about all of those invisible bits, like all the health problems they're creating by diverting resources to COVID. No one's talking about mental health issues. And, they are a bit, but not very much. So the emphasis on the immediate, the emphasis on the stay at home, full stop, then becomes very hard to unravel as you move to the next stage. So you've kept it very simple, which has worked, but people have got into their heads it's stay at home. It's not actually stay out of crowded places, stay physically distant from people. So as you want to say, well, actually, if you're outside, as Matt Hancock said this very morning, it's quite different to inside, that becomes more complicated. And we were always going to have this, but the simpler and clearer the message, and it was incredibly effective, as you say, we had, great compliance rates, the more complicated it is to move to the next stage. Okay, as you want to have a nuanced message.
As we all know, not everyone stayed at home, but we'll pass on that one. You've been critical, though, of the 5 tests that the government has been repeated. And you say that, as you said, the visible and the immediate, the number of deaths, number of cases. But what then would you be saying now? If you're not going to, if you think those 5 tests are not sufficient or indeed may hold us back, which I think is what you are saying.
Yes. Yes.
What then now should be the tests?
It's the wrong category, right? Basically, the government should be thinking about, in terms of lockdown, when does it make sense? When do the costs of the lockdown outweigh the benefits? That's the simple point for the country as a whole, right? There are great benefits from lockdown. It has an immediate, visible reduction in cases and deaths and things like that. But there are costs, more domestic violence, mental health issues, and the longer term economic costs of unemployment are massive. We are going to have massive unemployment. That's the one thing all economists will tell you, that the economic consequences of this are not equally shared. The young are going to be hit very, very badly. We're going to have a big youth unemployment problem. It's not a good year to be leaving school or further education or universities. There's only a limited amount government can do about that. I hope they will work incredibly hard on this. I've got some ideas about it, but that's going to be the nature of the problem. So we need an emphasis which takes account of all of those things. And at some point, the economic and cost to the country, cost to the country's well-being of carrying on with the lockdown are offset. It's just better to ease up. And how do you ease up? Well, of course, you ease up in ways that improve the economy, but also minimize the risk. So there are various ways you can do that. As we know, you're looking at those things and balancing those risks. So it's all about trade-offs. And unfortunately, the dialogue so far, nobody's talking about trade-offs. They don't like to. You know, in the medical world, you know that there are issues where you talk about some things where, you know, the National Institute of Clinical Excellence, quality adjusted life years. What's that? But it's about the trade-off between cost and extending people's quality of life. Ultimately, some of those things need to be tackled.
Well, okay, well, let's talk about that again. I read about you in the Daily Mail last week. I was surprised, actually, because there's an article which is all the things that you wouldn't expect the Daily Mail to like. It was about economics. They don't like that. The LSE, they don't like. It was academic and involved people like you, Richard Layard, who I think they probably don't like much either. So how come you got a major piece in the Daily Mail, and what was it you were putting over in that?
Well, I think we were trying to get this point that there is a balance, that this is not just about those things that are thrown at you every day in the press conferences, which is numbers of cases, numbers of deaths, and even those, you know, from a statistical point of view, I have my worries about how those were being presented. But, you know, there's more to it than that. It's more complicated. And the simplicity point that, you know, this desire to focus on the visible and immediate, and of things that they knew they would be able to turn around. You knew that the number of cases and number of deaths would fall. So it was going to be success, just a question of when. That basically meant that all of these longer term economic costs, which we will be living with for a long time, unemployment, you know, if people get unemployed for a year, that blights their prospects for life. You know, we know things about long-term unemployment that are dramatically bad. We know about some of the problems with schooling. Kids not being in school now are going to affect them for very long periods. Now, you need to balance these things. So when someone's thinking about, do we reopen the schools? Yes, of course, there's an increase in infection risk, absolutely. But what's the upside? You know, what you know, we stop doing something which we know is very damaging to education, and we know that that's not neutral across the whole of society. Some people are very capable of getting private tutors. You know, some schools will be brilliant at this. Some parents will be brilliant. Many won't. And that will basically, those people who are single parents, who are poor, who are, you know, not probably the best schools, there's going to be all sorts of issues which are going to go directly against this government's agenda of levelling up. That's a real problem.
And someone is also asking the question, particularly about vulnerability. And if I take you back to what I think is my favorite thing you ever wrote, which is your BBC lectures in 2013 in Defense of Bureaucracy, great title. And you pointed out that the point of a bureaucracy is about fairness, that it's not about, you know, yes minister and stifling innovation and all that kind of stuff. It's about to have a system that treats all equally. That's exactly what you said. And you say it's about protecting us from the evils of corruption, abuse of power, and indeed the oppression of those unable to speak for themselves. You know, ethnic minorities, those mental disorder, every person in the Ken Loach film and so on, against the powerful, privileged and so on. That was a brilliant, absolutely brilliant thing, and people should listen to it, except they can't because it's not available. But all of that says we're failing that now, aren't we? I mean, the civil service you led, the governments that you served, and the new governments, we are going to make all of that worse. We're going to be widening inequalities and so on and so forth. Does that disappoint you? Or do you think there's no way of escaping that?
Well, first of all, Simon, would you take up a job as my agent? I've never heard it described so
oh, no, it was
accurately and so well. We certainly, the consequences of this episode will be with us for a long time. And I have been arguing for quite a long time now, ever since I retired, but also from the outside, whereas I was arguing from the inside before, to try and make the overall well-being of the nation the kind of goal of what governments are trying to do. And I've been trying to write stuff about that. You're absolutely right that the point about bureaucracies, the point about things like the NHS, free at the point of delivery, you know, is to try and even out some of those inequalities, to try and create fairness, and I think it's one of the great strengths of the NHS that, we treat people on the basis of need, not on ability to pay. It's brilliant, and it's admired throughout the world. It has its drawbacks. Let's not have any illusions about that. But on balance, it's the kind of thing we should be doing. And yes, this whole episode risks putting that back substantially. Now, how do we solve that? I'm always in the position of how do we do this? And the phrase, of course, from the people who gave us, just get it, take back control, get Brexit done, stay at home, I suspect we'll be building back better. Right now, how do we build back better? And I hope in that we'll get this emphasis on what's gone wrong with this crisis. Well, one of the things is we weren't ready for it. And that's because we don't spend enough on prevention. We spend an enormous amount of money on cure. And if you look at the NHS through this, all of that money set aside, which I remember doing after the last one for PPE and other things, recommendations on the risk register. When you're running the NHS hot, that money gets diverted somewhere else. And we need to find a way of giving prevention more weight rather than cure. And if you give a classic example of that is, how do you solve issues about crime and poverty? It's all to do with the education system. So you need to think about the well-being of the children and how do you solve that issue? Other long-term big problems, climate change, it's about prevention. We need to be acting now. And we've now seen how brilliantly, if you just take the cars off the streets, air quality going up, that will improve people's health. That will do all sorts of good things. Can we learn from this crisis some long-term lessons about building back better? And that will be about addressing the inequalities we are creating at the moment and creating a better world where we place more attention on prevention and less on cure. The problem is you take the health service, this may be unpopular in this audience, but hospitals, doctors, nurses get the attention, they throw money at that, whereas I want to throw money at keeping people as far as possible away from all of them.
Well,
Make them redundant.
Well, I wouldn't go quite that far, but I think most of them agree you should. But Finola, Richard Allen, and several others, they've all pointed out that we're supposed to have got crisis management, worked it well with the Civil Contingencies Unit you helped set up and so forth. Now, you just said we weren't ready for this, and yet it was number one on the National Risk Register. That was part of that group, actually. Yeah, so how come we weren't ready for it? I mean, it's an obvious, you just slipped in, we weren't ready for it. Why?
I think that, we had done some preparatory work, and we'd done some preparatory putting things aside. And as time had gone on, if you're in government, let's find some money somewhere to handle this immediate, visible crisis. Remember, coming back to the politics of visible and immediate. And you're spending all this money on this stuff that you're never going to use. In an ideal world, you'll never use. It's a kind of insurance premium you're paying. And it's so easy to raid that. So institutionally, we do need to find a way to ring fence prevention money away from the rest. Otherwise, it will always be. And this isn't the biggest mistake we could make is fighting this war again. We need to do this as a general concept of prevention, not cure, because the next crisis may be something in cyberspace. It may not be anything to do with the health service. But we all know now how much we rely on the internet, for example, and how it can help us in times of crisis. So yes, there are institutional problems about why we spend too little and political problems about why we spend too little on prevention rather than cure. And the way to solve those is to get independent, partly to think about what you want to keep within the political sphere and what you want to make give to institutions to have control over. Yes, overall political control, but don't let the politicians make the day-to-day decisions. That's what Gordon Brown did when he set up the Bank of England as independent. He didn't want politicians being able to say, oh my God, there's an election coming up. Let's cut interest rates because that'll be popular. He said, let some technical experts sort out what to do with interest rates. We'll set an overarching goal, which is get inflation at this target level. And then the technical experts go on and deliver it. Well, good principle.
It is. I'd be tempted to go down the route of experts, but I think that's been done many times. Now, my eye is just caught to one of our questions, Peter Wright, a name familiar, no doubt, to one of our previous guests, the head of MI5, but I think it must be a different Peter Wright, at least I assume so. But it's asking about how we get out of this. And here in its issues, so are we going to start being much more regional than we have been before? And as London has now hardly any new COVID cases, why can't we lift lockdown in London now earlier than the rest of the country? And that's a political judgment, isn't it? It's not just a medical judgment, it's a political judgment.
Yes, and I will try to answer in honour of the person that asked it without being short with the actuality, as it were. Economical with the actuality, I think was the phrase probably used.
Okay.
Yes, I think we'll enter this phase where anyone that's doing the cost benefit of when we should come out of this will know that clearly we want to have the circumstances where we are not going to restart things in such a way that we get a new wave that's bigger than the first wave. So you've got to clamp down quite a lot. But also, anyone that understands these things will know that an average number for R is a ludicrous concept, and that we need to separate this down. In an ideal world, what we would be doing is measuring these things, testing much, much more, so that we were able to spot regional hotspots, local hotspots. And then I would be very much in let the local community sort out how to manage that local hotspot. Let them see, because it's a very different thing if the hotspot emerges in a relatively widely distributed area versus in central London. I mean, that's obviously going to be different. So you need kind of quite different rules. You need a bit of flexibility, you need a bit of discretion. All of those things to me suggest trying to devolve power away from the centre. And as it were, the thing the centre was going to provide was this wonderful app, which seems to have disappeared from view in the Isle of Wight. I mean, we went down a route which I personally thought was a rather odd route, wasn't using existing IT systems, which seemed to work. But anyway, doesn't seem to be there up and running. So we will need to rely on human intelligence, human tracking, which I think is smart and sensible. We know all sorts of ways of doing this. We have people that do it. So I would be for very localized, actually it's beyond, it's smaller than regions, localized discretion to handle these things in the best way to try and control those outbreaks, those wavelets, I will call them, as they emerge.
Okay. Now we've also got questions on other countries, Sweden, New Zealand, etc. Now we haven't really got time to answer those, but just to tell people, we will be specifically addressing those in the next series of the webinar on next Tuesday, and we'll bring back Martin McKee to particularly deal with those issues. So they haven't gone away and we haven't forgotten. So I want to kind of end then with you back at your beginning. You're a South Londoner, I believe. You're a big sports fan. You played pretty good football. You were Oxford Blue for football, etc. And you're the chair or president, or you're something at Wimbledon, aren't you? Ball boy? I don't know.
On the board. I'm
on the board.
Director.
You're on the board. Okay. Tell me, when, if ever, do you think we'll be able to watch major events like Wimbledon, football, horse racing again? Do you think it'll ever be possible?
Yes. I mean, you'll almost certainly see Wimbledon next year. In an ideal, if
Wimbledon as it was, or some social distance?
That'll be a question of have we developed the vaccine and all the rest of it. All sorts of questions that you will know the answer to better than me or your audience. I mean, the trouble with doing these things behind closed doors is they meet certain criteria. Like if Wimbledon was just about the tennis, sure. And so football, if it's just about the football, then I'd say actually go ahead with it behind closed doors, and let's be able to watch it. And the CGI experts can put a crowd in. That'll be fine. Wimbledon is about an event which is tennis, but it's strolling around the grounds. It's being able to have a strawberries and cream and a pins. It's a it's a social event really, and it's harder to see how you manage those sorts of things. So I'm very keen that we do get back, because I think those are part of our culture. They're things that I love personally, and I know lots of people do. I really hope we'll get back to a situation where we can manage these things. But that does require us to be able to think about how do we bring quite a lot of people together in the same place occasionally.
Yeah, okay. It's not the totally optimistic upbeat answer I was hoping. I actually had my first ticket ever for Wimbledon this year. I've never been before, and now it's been cancelled. So I'm very cross with all of you. Anyway, Gus, thank you so much. We'll have to stop at that time. Don't go away just for a second whilst I just wind up. And thank you for everyone who's tuned in. This is all part of our RSM COVID program, Health Professionals for Health Professionals, and any support you can give both to this and to our evening series will be very welcome. So the next date, as I said, is next Tuesday, 12:30. I'll be chairing our monthly catch-up with all the questions, which now number several thousand, I have to say, but we're picking out key ones to pick up with Martin McKee, the European Expert Extraordinaire, Stuart Ralston from the Commission on Human Medicines, and the intensive care expertise of Alison Pittard, all of whom were featured earlier in the series. Then on Wednesday evening at 7 o'clock, it's time for something completely different, as they say, because Roger Kirby will be interviewing no less a person than Sir Michael Palin of Monty Python fame. And what does our best loved traveller do when you can't travel? Well, the answer is he's going to reminisce with us and the Royal Society of Medicine, 7 o'clock next Wednesday. So Gus, thank you very much for coming. It's been a delight and challenging and slightly worrying in equal measure. And I'm sure we'll talk to you again. And then to end, as we always say, the end of Hill Street Blues, stay careful out there. Good afternoon.
Bye-bye.